And hi, everyone. TJ Alds, I-45 now and Pod Now. Welcome to another edition of Healthcare Unmasked, presented by UTMB Health. We're talking about men's health. June is obviously Men's Health Month. If anybody out here, I'm the perfect example of what I need to actually start learning about men's health a little bit and here as well. And we have Dr. Darpan Patel here who's with us to talk about that. And we're looking forward to having this conversation with you. Thanks for coming on with us on the holiday week.
I appreciate it. I'm glad I got the opportunity to be on this podcast. I've heard so many good things about it. I get to sit next to the TJ, and we have a good conversation today. I'm looking forward to it.
Well, I am too, and it is one of those things. This is one of those rare times we don't have the advance. We were going to get together early, and then we realized, oh wait, we had a holiday. We couldn't do it. So we haven't had we've been having our conversation before we came on the air today. When we talk about men's health, let's just talk about in generic terms before we get into the kind of what you specialize in. When we talk about men's health, what are the biggest, I guess would be say, challenges of convincing men like me to stay healthy?
Or just to go see the doctor.
Right. That's the thing. That's the other thing too, right?
Right. Yeah. Behavior change is hard. Like having solidified plans and having the integration of healthy living lifestyle is really a complicated thing, right? Everyone says, oh, just go out for a walk or eat better. And so there's a lot of different things that play into that, right? Like some people may not know what it feels like to go out or have the opportunity to go out and go for a walk, right? Because of their environment that they live in or because of their lifestyle that they live. Or the environment that they live in. And so there's a lot of factors that go into maintaining one's health, of course. But I think what we could get away from this month and all the other months throughout the year is a better understanding of what it requires of us to maintain a healthy lifestyle. And I think we're going to get into a little bit more about the nitty gritty about that during our conversation today. But at the end of the day is sometimes there's a fear aspect associated with it, where the less we know, the better. I don't want to know I'm sick because then I'm sick. Whereas if I just have a cough or I have a little ache, it'll go away hopefully in a few days or a few weeks, and I'm just going to live with it. And so the unknown, it's a whole thought of the ignorance is bliss phenomenon. And so if I don't have to worry about it, I don't have it.
Right.
And so that oftentimes prevents us from going to seek care from the doctor and prevents us from getting the assessments or scans or blood work that we need to ensure that we are in the right trajectory to maintaining a healthy living life.
Now that's the part that that makes common sense, right?
Yeah.
But how do you, as a researcher and as a physician, take that next step of the old line is you lead a horse to water,
right?
But you can't make them drink.
Yeah.
What do you do to make that work?
Yeah. So in my area of research is really focused in on exercise and nutrition, right? So that's the basic things that we could do in our lives, right? We maintain active living through moving and eating right.
Mm-hmm.
We know that's good for us, but what we don't know is what the mechanisms are behind that. Right. And so the work that's being done by my team here at UTMB, particularly in the School of Nursing with the interdisciplinary team that I have, is really focused in on the how. Right. And more importantly, answering the why is it good for us. Right. So we know that exercise is good for us. It's good for the bones. It's good for the muscles, good for the heart, good for memory and quality of life. But what we don't know is what's going on in the cellular level inside our body to help us explain physiologically what's going on. Right. And so when we think about the integration of healthy lifestyles and healthy eating, and with respect to disease prevention, or at the very generic sense of it, like how exercise and nutrition can interact with drugs, right, that we're taking because of cholesterol issues or high blood pressure or diabetes, whatever it may be, we need to be able to see how exercise is changing the physiology in their body. And that's what we're doing in my group here at UTMB, is really understanding the physiological side of exercise and explaining that to the general population, so that way we could better integrate healthy, active lifestyles into our normal day-to-day routines.
Because it gets into that I mean, there's kind of two versions of guys. I'm one of them that like this, that my physical activity is around work, but not going to the gym or that type of thing, or walking all the time. The other are the guys that are get out walking, like our executive producer, Carl Halava, who's lost lots of weight.
Mhm.
By the way, none of it through Ozempic or
Yeah,
any of that
yeah,
stuff.
yeah.
I mean, just going out every day and walking and watching what he's eating. And so you have those kind of and then there's, well, it's actually the third. Then there's guys that are just going to the gym every day
Yeah,
and getting
yeah,
up, and I don't want to say roided up, but just getting pumped up. And so when you get that, that you have those three sets, but when the folks that are kind of in my category
Mhm.
here, and there's just, "Oh, I'm working too hard," and everything else. What's the simplest advice you give them about staying healthy?
Yeah, so one, it's about education, right?
Right.
I think the biggest thing is to inform the community of like the people in bucket one of the
Right.
benefits, right? Of what eating healthy looks like, what maintaining active style looks like as well. Um, Education is first and foremost. The other is the integration in little chunks, right? Like
Right.
oftentimes we think that exercise, in order for me to become physically fit, I need to go to the gym for an hour a day, 5 days a week, or I need to go out and walk an hour, or I need to get my heart rate up to a certain level. That's not it, right? We don't have to do that. Particularly for people that are living sedentary lifestyles, we actually don't want you to just go straight to the gym and get on the treadmill for an hour a day, 5 days a week, because ultimately you might end up hurting yourself, because that's doing too much too fast, right? We don't want to do too much too fast. And so what we're calling this in the exercise science world is exercise snacks, right? So do a 5-minute bout here or there, right? Where that adds up to what we're considering like the minimum physical activity guidelines. So the minimum guidelines prescribed through the American College of Sports Medicine, the American Heart Association, any governing entity when it comes to disease prevention, is focused on individuals getting about 30 minutes of activity a day, right? That doesn't have to be 30 minutes continuous. Research has found that you could break the 30 minutes up into 5-minute or 10-minute increments and still get the same benefits that you would if you did all 30 minutes together, right? So think about exercise snacks and integrating exercise snacks into your day, where you might be active as part of your normal day in, day out routine,
Right.
because of your work or just, gardening or whatever it may be. And that's great, right? But let's see what we could do about integrating 5-minute bouts of maybe walking or chair sit to stands. You don't need to go to the gym to maintain these benefits, right? These exercise snacks are going to go a long way to getting an individual that's sedentary to moving and then once they're moving, then we get them up to bucket number 2 and we get something more integrated, and then we take them up to the next level.
I like your term, exercise snacks.
Yeah.
For a guy like me, when I heard exercise snacks, I said, "Oh, I just have to go eat something."
Yeah.
But that makes sense. Just a little small something,
Yeah.
little small something, little small something. And I hadn't thought about it, because I think most time people think they got to get their hour in or half
Yeah.
hour in one swoop, get that heart rate up and everything else. But you're saying just
break it
start
up
with that.
Yeah, start with little things like small victories. Small victories add up to larger victories, right? And so start off with 5-minute increments throughout the day, right? After you have your coffee, or while you're having your coffee, walk around the house, or while you're on the phone, take a little stroll, right? There's little things that we could do throughout our day to integrate activity that we may have not thought about before.
Awesome. Well, Dr. Patel is going to be on with us for a while here. We're talking about this. We're going to also talk about how the work that he does really does get into also about cancer prevention. And that's something that I think a lot of folks don't think about along the way, that exercise can be a big part of that. And we will be taking a look at that when we come back after these words from UTMB Health.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.
Welcome back to Healthcare Unmasked, presented by UTMB Health. We're talking about Men's Health. June is Men's Health Month, and already I'm so excited to be here with Dr. Darden Patel, who just you've already, as I said, you hit that line about doing with the snack size of the exercises and stuff. You said something to me before we went on the air that I found really fascinating, is that the great thing about your job is you don't have to prescribe anything.
Yeah.
except say, go get some exercise.
Pretty much, right? Exercise is one of those things that you don't need a prescription for, right? We know that it's good for us. We just got to find a way to get around that inertia of not moving, right? And then once we build that momentum up after we get over that sedentary lifestyle, it's going to be like a pebble going down a hill. It's going to get a lot of momentum. You're going to feel the benefits right away, and that's going to encourage you to continue doing more. So the work that we're doing here is really trying to understand what basic exercise looks like, as far as like 30 minutes of walking a day. And our group has found the benefits of that in the prevention of cancer recurrence, particularly looking at biomarkers associated with prostate cancer recurrence. We've also seen that in the healthy individuals, that it helps prevent the onset of disease, onset of different cancers as well. And so different modalities, different interventions that we could do, exercise interventions I'm saying here, doesn't necessarily require a physician's prescription. And you don't have to go fill it, right? You don't have to go to the pharmacy to get this prescription filled. You just got to know what's right for you. And we're here to help you do that.
What is the setup for men's health here at UTMB Health, so people can understand? Because I know when we were talking the other day about, over in your area, that, hey, we have a gym over here. We have this, that's part of it. Kind of explain to folks what's available for men to come to UTMB.
Yeah, on the clinical side, we have exceptional men's health physicians here. And UTMB, being that we are academic health campus, we are really here to serve our community and serve our citizens that live in our catchment area. And so we have exceptional physicians that are here to serve men's health as far as normal aging goes, endocrinology goes, GU health, genital urinary health, incontinence issues, the gamut, right? So clinically, we're exceptional. The research side is also complementing the exceptional work that we're doing on the clinical side as well. Research-wise, we're making significant strides in uncovering the mechanisms and the pathologies associated with different diseases associated with men's health, particularly with respect to prostate cancer and the treatment for prostate cancer. Our group is one of the ones that are leading the way in the understanding of exercise and the mechanisms of exercise and how that could help prevent the onset of cancer, while also studying the effects of exercise during cancer treatment to see how we can maybe better improve the outcomes associated with different therapies like chemotherapy or androgen deprivation therapy. That's oftentimes the backbone for treatment for men with prostate cancer. So UTMB is an exceptional place to come for care for men's health.
When you talked about that what happens here, it's obviously my wife, who's in education, always says the bravest step any student makes is just pulling into the parking lot.
Yeah.
And you were talking about small victories of that. It's just show up in many ways.
Mm-hmm.
But even I don't mind sharing this, this history. I mean, my weight has been a problem since, a few years after college. I, put it on. I had, weight loss surgery, and then that did very well for a while. And then, then I had crushed my legs, and then my physical activity goes down, but my appetite didn't, those whole things. And then it's that kind of kickstarting and go back. And that's the thing, is I know what to do.
Yeah.
I mean, I can sit there, but I can also justify, not today.
Yeah.
And not today. What is kind of a simple suggestion you have for folks like myself who are like, I'm over 400. And I like what you said about, it's a simple thing, the small victories. And I used to take that approach, which was, I don't need to lose 100 pounds today. It ain't going to happen in one day.
Right.
If I just work out and feel good afterwards, it's going to hurt like heck right now. But, and I'll be sore. But after a week or so, my body will be used to it. And
Absolutely.
I'm like, that. And I don't have to go all out and finish everything. Okay, if I drop a few pounds, okay, great. If I'm feeling better, if I'm drinking more water, those types. But, what's the kind of a simple way you can talk to someone like me to convince them in their head to start thinking that way and acting on it?
Yeah, the first and foremost, I think we need to understand that behavior change is hard. Right? It's hard to get out of our routines that we built in our day, right? The struggles of work-life balance, right? And ensuring that we're maintaining a work-life balance and being there for our family while also making sure that we're not dropping the ball in the office. That those are those things that we carry with ourselves every single day, and that adds a lot of burden to our life. My thing is setting yourself up for victory the day before, right? Having a plan. And maybe that's starting with just putting your exercise clothes out the night before, or maybe even sleeping in your exercise clothes. So that way that laziness in the morning might already be mitigated because you're already dressed and ready to go, right? And then go out for like a 5-10 minute walk before you go for a shower, and then you get ready for your day, right? These small little adaptable changes into your life are ultimately going to build up over time, and your body's going to tell you that it's going to feel good. It's going to not feel good maybe immediately after, right? Because you're going to be tired, you're going to be sore, but guess what's going to happen? The energy is going to come back, right? You're smiling, right? The cloud that you may wake up with, the haze that you may wake up with in the morning is going to be gone. And at the end of the day, not one size fits all, right? We also need to understand that. We also need to understand that what may work for one person is not necessarily going to work for another person. And so when we think about exercise and behavior change, it's got to be a personalized method, right? Every individual has their barriers that they have to overcome. And it takes an individual to be able to identify what those potential barriers are and find ways to work around them in order to integrate some of these things. And so what we would do, if you were coming to see me, is really be upfront with you and say, hey, what are some of the things that are preventing you from being active? And let's find ways to work around those, so that way we could, again, integrate some of these exercise snacks first and foremost, and then help build in that routine into your life. Because once it becomes routinized, then it's hard to break that routine again.
Yeah, because you break one routine, you start a new one. Right. It'll be hard to break that routine at that point. Yeah. We are people of habit, creatures of habit.
Exactly.
That goes along the way. Yeah. And there's a lot of time I find it with me, it's more of kind of the self-confidence thing of, do I really want to do this? And I'm finding the reasons I don't want to do it versus the reasons I should. And I just, I know better.
Yeah. And so sometimes it's not about the me, right?
Yeah.
It's not about like what might be good for me. I think one facet that we use in this research is motivational interviewing, right? We want to know what motivates you, whether it's, you want to lose weight because you want to fit into this outfit, or like, for example, women sometimes do that because they want to maybe lose some weight before they get married, or before their daughter's marriage or son's marriage, whatever it may be, or a special event. For every individual, the motivation is going to be different, right? So we use that motivation to our advantage, right? And so in the cancer side, oftentimes what the motivation is to live long enough to be able to see a grandchild grow up, or be able to walk someone down the aisle. So these monumental lifetime events that occur. And so we use that as a motivation, right? So not necessarily about the me, but it's about the we. And I want to be there for her. I want to be there for him. And we use that as a motivation to implement behavior change into an individual, particularly as we think about longevity, and because we're all living a longer life, right? The expected life expectancy is pretty consistent right now, but it's been going up over the last couple of decades. So we're living longer. It's about the quality of the life that we're living, and we want to make sure that we're going to be able to be here for other people, right? And so we use that motivation to sometimes implement this behavior change.
We are with Dr. Darden Patel talking about men's health. And how long have you been here now?
I've been on the island for about 1.5 years.
Yeah. You enjoyed it here, by the way. I should point out. Yeah.
I live on the seawall, so there's nothing like waking up in the morning and seeing the Gulf of Mexico with the sun shining on it, and then driving down the seawall to get to UTMB. It's a lifestyle that I feel like I needed like maybe 30 years ago.
Yeah, I think today the building over here at Levin Hall, they went ahead and set up. They knew it was Men's Health Month, so they shut down the elevators and we had to take the stairway. So for that, and we are going to get back to the cancer stuff. When we come back, I want to talk about nutritional stuff, just the simple advice that we can give men about hey, hey, come on, we're meats and potatoes guys,
Yeah.
and not a lot of vegetables and stuff. But what Canada does and what they can do to help themselves out as well. For those of you watching live too, by the way, we do have coverage of that fire that's going on in Hitchcock right now at Harbor Walk. We'll have updates for that for you as well. Just keep here on I-45 now. When we come back, we'll be talking about nutritional side of things. That's also a key component of what we'll be discussing on men's health after these words from UTMB Health.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB Health specialist near you, visit utmbhealth.com. UTMB knows when you're expecting, you may not know exactly what to expect. From that first embrace to all the milestones that follow, we know how important each stage of life is. That's why UTMB Health's obstetrics and gynecology physicians specialize in innovative women's health care through all phases of life. UTMB knows women's health. UTMB knows you. To find an OBGYN specialist near you, visit utmbhealth.com/women's.
Welcome back to Healthcare Unmasked. My apologies, Dr. Patel. I've been saying Darden the last two segments. It's Darpin.
Yeah.
Dr. Darpin Patel, PhD, big time PhD. I should point out here on that. You got it in Florida?
Florida. Yeah, go Gators.
We're moving to the SEC, so now we
You
got a
know,
little rivalry.
it's going to be a good wake-up call for you when you get there.
Yeah. See, I keep hearing that from all the SEC teams.
Same thing happened to A&M when A&M transitioned over. Right? They got a rough awakening when Johnny Football threw the pigskin against Florida the first game.
Yeah, that's right. See, I like it. A guy knows how to really says.
Florida's playing Texas this year too, I think so.
Yes, it'll be a fun one. Yeah. So, and if you had questions, go ahead and pass along the info here. Questions, we'll have Dr. Patel answers those. One of the things I was talking about is, and I appreciate the advice you're giving me on this as well. But hopefully, the viewers are taking this more than anything else. Is that nutrition side of things? That's the other thing, because we see so much get on here. Let's try this diet, or here we go. You can order the foods and it comes in this way and it's pre-made. And even at grocery stores, I say, here are the healthy fit foods. And also, what can people do, what men in particular, that they still feel like they're not starving themselves to death, but eating healthy that helps with metabolism and helping lose weight and stay healthy, because there's two different things between losing weight and staying healthy.
Yeah, because you can lose weight the wrong way. Right. And then that's going to ultimately hurt you rather than helping you. And so the first piece of advice is to colorify your plate. Right. You were talking about meat and potatoes, right? Those are very bland colors when it comes to a plate. Yeah, it's nice to see that nice piece of steak with some green beans and some mashed potatoes on your plate. But the more colors you could add to your plate, the better. Right. So that's first and foremost. I think that's an easy change that we could do. Right. We're talking about these small incremental adaptations we can make to our life. One is to add more color to your plate. If you add more color to your plate, that means you're adding more grains, more vegetables, right? And so colorify your plate a little bit, right? The other is to reduce the amount of fats that you're eating, right? And it's not that hard to determine fats versus proteins and things like that, right? Because when you're cutting off a piece of steak, it's really easy to see what that fat looks like.
Right.
Now imagine just gnawing on that for a while and increasing over time the amount of fat that you're taking in. There's a big obesity epidemic in this country, and we know a lot of that is derived from the American diet, right? And the evidence even suggests that individuals that grew up in the Mediterranean area, which is the Mediterranean lifestyle, is very, very big, right? The blue zone diets. Everyone's been talking about the blue zone diets the last couple of years, and so the Mediterranean area or the Japanese diet, which is high in fish, right? The good omegas. There's data that shows that individuals that live there, that transition to the US, because of the lifestyles that we have and the diets that we consume, they're significantly increasing their risk for cancer, for diabetes, for cardiovascular disease. Whereas if they would have just stayed there, that risk would not have been there as high, right? And so there's prevalence here in the US just because of the lifestyle that we live and the diets that we consume, right? And so we consider the standard American diet as that of heavy meats, heavy potatoes, and starches. And there's this nice image that I like to use in a lot of my talks, where the standard American diet is actually making our body sad. That's what standard American diet stands for, is making our bodies sad because of the high amounts of fats that we're consuming. Right. So one way, and the second way is to reduce the amounts of fats that we're consuming in our diet. Right. So get away from the red meats as much as we can, because red meats are oftentimes high in fat. The chicken, the fish is a nice alternative to that. You're still going to get your protein intake. You're still going to get the good cholesterols through the fish. And so combining the reduction in fat consumption and increasing the colorification of a plate, I think are going to be some easy changes that we can make as a society to help improve some of the health that we're talking about today.
Tough thing about that too is I've noticed, something we'll say you come in and it says, less salt or less sugar or those type of things in the grocery store, and you really don't know what is what. When you go shopping and you're looking at foods that can keep you healthy, particularly for your heart, prevention of cancer and stuff, what are you looking for on the label that can tell you? And maybe what you're saying is, don't go to the places that have labels. Go to the places that
the bulk items, right? Where the fruits and vegetables are. But no, we all need things for convenience sake, right? Like not all of us feel like soaking beans to make refried beans at night, right? But we go to the cans to help simplify our life and our food prep. And so what I would look for is things that are added in. Right, the added sugars, the added salts, and what percentage of that's added into the food that's going to be considered to be part of our percentage of intake for the day, right? So every food label will tell you what the grams or milligrams are of sodium, which is the salts, sugars, and fats, and there's going to be a percentage next to that number. That percentage is based off of a traditional 2,000 or 2,200 calorie diet, which is what we would consider to be normal for an average individual. So that percentage is based off of what the recommendations are for intake, right? And so if you see foods that have a higher percentage of fats or higher percentage of sugars, those are the ones that you want to really stay away from, because that means they've got a lot of added stuff to them, for a lack of specific terms, that we probably want to stay away from.
Then the next part of that on the nutrition side of things is the things, when you go out, because we are a society that eats out more than in any other, whether it's fast food or restaurants. How do you do that as someone if you're bouncing from one thing to another?
Man, that's hard. That's hard. You go to a Mexican restaurant, you see that chips and salsa in front of you, and all of a sudden you've got like 14 tortillas in your belly by the time the main meal even comes out. And so it's I'll be the first one to admit it's hard, because I love me some chips and salsa, especially when I go to Salsas or somewhere down here on the island. But it's about moderation, right? Being able to understand that moderation is key. And I'll be the first one to admit I'm not the best one when it comes to this, right? When I go out to eat, I like to go out to eat, and I'll save the calories for at home. But it's okay to indulge yourself like that, right? And get the dessert, because hopefully you're not going out to eat every single day and getting the dessert every single time you go out. So it's okay to celebrate, right? It's okay to treat yourself every once in a while and not feel bad about it. Right. So don't beat yourself up because you had this triple chocolate cake today because you were celebrating someone's birthday. You don't eat a triple chocolate cake every single day. Hopefully you don't anyways.
Right.
If you do, then we got to adjust that. But it's okay to treat yourself every once in a while.
And somebody posted this the other day when you're talking about chips and salsa, that when you eat all the chips, if you really it takes it's like one tortilla is like 8 chips. Like if you've eaten 16 chips, you've eaten two tortillas, and you don't think of it that way. And you go, oh wow, oh okay,
that's exactly what I was thinking about when I mentioned that comment. Because when you're snacking on things, you lose count sometimes.
Because it's just it's a habit thing to
Exactly.
go through and all. And I know that I'm horrible with that
Same.
as well.
Yeah, same.
And then the other part of this is that what do you drink? I mean, we always hear water,
Yeah.
get more water,
Yeah,
get more water on there. What is good to drink is water, obviously.
Yeah, water's great.
Yeah.
Right. Your body needs it.
Yeah.
But soda, if you're going after the soda, what I would actually recommend is getting the soda water. And maybe squeezing some lime in there if you're
and you're talking about soda water,
carbonated
not
water.
carbonated water,
carbonated,
not
not
like a Topo Chico or
right,
something
exactly,
like that, right?
Yeah, because sometimes it's just the bubbles that we like.
Yeah.
The texture of the water that we're drinking sometimes is really what drives us to like a Coke or a Coke product. I don't know if we're branding here, but
that's right.
Cool. But to those sugary carbonated beverages, right? And so squeezing a little lime in there and some Topo Chico or some sort of carbonated water, I think will be able to help quench that desire.
And to promote brands. I was talking to you about it before, and you'd heard about it. It said I did a sparkling ice that I just love. It tastes like tastes like the soda water or pop or wherever you're from, whatever name you want to use, but it's pure water, no calories, no added sugars, nothing.
It's good to find those alternatives.
Right. Yeah.
There's alternatives out there for us. And you see a lot of these ads now that are coming out about like flavored carbonated water, right? To get that sweetness that we really go for when we go for a Coke or a Pepsi or whatever it may be. But there's alternatives now. So find those alternatives.
And for a guys' night out, going out with the guys, playing golf, bowling, whatever it is they do, there's always going to be beer back and everything else like that. We see 99 calories or those type of things. We already know really.
Right.
You don't. Again, is that one of those things? Moderation. I'd say I don't want to say treat yourself with alcohol, but just really watch yourself with that because the sugars and everything.
Because it does add up, right?
Right.
Even if you go out and the rule of thumb is like 3 drinks for average aged male. And so if you do the math, and if each drink is 120, 150 calories, you're going 360 to 450 calories just like that. And if your diet typically is 2,000 calories a day, a quarter of your calories are just already intake because of the alcohol that you're consuming. So again, moderation, have a plan, right? I think what we're getting at today is having a plan. Right. Even when you go out to eat, is have a plan, particularly if you're on that quest for weight loss or modification because of hypertension or diabetes or whatever it may be, is have a plan, right? Know what check them. Everyone's got a menu out now, right? You don't have to be surprised once you get to the restaurant of what they have to offer, right? Go online, see what they have to offer, have a plan going into the meal and execute your plan.
Gotcha. When we come back, again, I keep talking about the concept, but I want to save the best part for last year. I'm going to be talking about the semaglutides, the Ozempic, and those from the weight loss side of things. You're getting for folks to hear your recommendation on that because a lot of folks are looking at that as the path to health. And as you've said already, there's a difference between losing weight and being healthy. And we'll be taking a look at that here in a little bit after these words from UTMB Health.
UTMB knows that good joint and bone health is the key to a pain-free and active lifestyle. UTMB Health Orthopedics specializes in providing innovative care for common and advanced orthopedic issues, including sports injuries and total joint replacement. UTMB knows orthopedics. UTMB knows you. To find a UTMB Health specialist near you, visit UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB Health specialist near you, visit utmbhealth.com.
Welcome back to Healthcare Unmasked, presented by UTMB Health here on I-45 Now and Pod Now. We're with Dr. Darpan Patel talking about men's health. June is Men's Health Month. I know we're getting to the end of it, but it's the 1 month that designated to focus on it. It should be something year round. we talking about, because when we talk about health, there's going to be folks like myself who are going to say, all right, I got to lose weight to get healthy, obviously. And obviously now we have the latest fad in that, obviously, is to use the semaglutide, the Mounjaro, the Ozempic, to that. What's your take on that as a way of getting yourself healthy? We know they work on weight loss,
Right.
but there are side effects on some. But at the same time, is that the path? If someone says, well, not only do I want to lose weight, but I want to stay healthy.
Yeah.
What as you look at that for men's health?
It really is a quick fix. That's really what we're seeing right now. That's a quick fix. And if you're willing to deal with the side effects, and the side effects are numerous when it comes to taking tirzepatides or those Ozempics that are out there right now. And so that's what we need to first and foremost be aware of. That is a quick fix. Long-term maintenance is going to be a lifestyle modification. You see any of these ads out right now, and they'll always point towards Ozempic works when in combination with physical activity and a diet, right? And so nothing in and of itself alone is going to cure the obesity epidemic, all right? Or for that one individual result in sustained weight loss, because it's not going to be a medication that you're going to want to be on for long term, particularly when it comes to weight management. If you're diabetes, that's a whole different story, right? But if you're looking at it simply for the fact that you want to lose weight, it's a quick fix, but that's something you don't want to be on for long term because of the side effects. If you combine that, more importantly, with lifestyle modification, there might be some benefit to that. However, with that being said, right, I did some work with some colleagues internationally that looked at tirzepatide versus exercise and combining the two together. We still found that exercise alone was far more superior than, or just, I wouldn't say far more superior. It was at least equivalent to tirzepatide, if not better than tirzepatide, in maintaining the weight loss over time, right? And so, again, lifestyle modification is hard. Adding medication to your life may not be the best thing for you, right? And so, of course, have a consultation with your physician, determine what's the best method for you to have that advantageous weight loss and have the weight reduction the right way, because you also don't want to lose a whole bunch of weight too quickly, because that's going to shock your body and there's going to be a deleterious effects associated with that as well. But when in combination with lifestyle modifications, it's something to consider. It really is. And we've been searching for what we consider like the exercise in a pill or immediate weight loss. And this might be getting us in that right direction. And the identification of GLP-1 as an inhibitor for weight gain is a great discovery, right? And now we got to take that discovery and use it to our advantage, so that way we could have targeted therapies and not necessarily utilize intervention that's really designed for diabetes and take away that medication from that patient population and apply it to a different population, because the manufacturers aren't ready for it yet. And so now we get into the phase of the quote unquote generics that are out there, when in fact there are no generics out there right now.
Right.
And so there's a lot of knockoffs that are posing as Ozempic or these other GLP-1 or GLP-1 inhibitors that aren't necessarily that. And so we got to be very, very careful and do our homework and do our due diligence and make sure that we're using the right stuff if we do plan to use it.
I was reading a report the other day that this is the most that the pharmaceutical world has seen since Viagra.
Yeah.
That as far as demand and everything else, and generics don't come around in the first part of anything.
Right.
It's going to be a while before
someone's
that
telling you they got a generic version of Ozempic or some other medication, run the other way, because there's no generics out there.
And when we hear people talk about, like there's compounding pharmacies out there that say, "Oh, same stuff, it's semaglutide and stuff like that." Is that hokum, or is it real, or is it a combination of both?
It can be. It could be a combination of the two, I think, because what we need to be aware of is that yes, they could compound it, right? In these pharmacies, but where are they getting the actual medication from, right? The fail safe is always to go to the doctor, right? Don't be your own pharmacist, don't be your own physician, and try to seek it out yourself, right? Do it the right way, so that way you don't end up hurting yourself in the long run.
And it goes back to full circle what we talked about. First thing you got to go do is to go talk to your doctor.
Yeah, exactly.
That was the first thing out of your mouth on that. When we come back, we're going to get into an area that's a specialty of Dr. Patel, and that is how better health prevents cancer. And it's more than just the generic term you hear all the time. So get healthy, don't get cancer. This is you've done a lot of research on this about certain things to do, particularly in prostate cancer and the like. And we'll be talking about that after these words from UTMB Health.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com. There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.
Welcome back to Healthcare Unmasked, presented by UTMB Health. Talking about men's health here on I-45 Now and Pod Now, as this is Men's Health Month. I had a good question by one of our viewers. Just says, "Why isn't he talking to you about your health?" Actually, he has been. We've been using my example of this, hoping people say, "Listen, I don't hide it, folks. I was healthy at one point, and I let the weight come back on there, and it's always something I'm working on." And so I appreciate, because I'm taking down notes as much as anybody else, I hope is as well on this. But let's get into the one of the kind of, I don't want to call it your only area especially, but an area that you really focus on. It's exercise for cancer prevention. Talk about that in general terms first.
Yeah, so exercise, we know, is great for lifestyle modification and prevention of disease, right? And what we're seeing over the last 25, 30 years or so is that exercise is just as beneficial in preventing cancers, and particularly certain types of cancers. There's a rich amount of data out there that shows that exercise is beneficial in reducing the risk for breast cancer, endometrial cancer, stomach cancers, esophageal cancers, and GI. Right, a lot of these cancers that are out there right now, some of these are lower risk cancers, some of them are high risk cancers, right? And so the evidence is out there now that shows that exercise is beneficial in preventing disease, preventing cancers in particular. What we're also saying is that exercise is also beneficial in preventing cancer recurrence, right? So not only can exercise potentially prevent the onset of cancer, there's going to be some instances where cancer cannot be prevented because of genetic risk. We're not at the point right now where exercise is changing the genes of the body, but we're really trying to get there and really understand why and what's going on inside the body. But what we're also seeing is that exercise can also potentially prevent the recurrence of cancer, right? Any cancer patient will tell you, right, when they hear the word cancer, it's of course scary, right? And then they go through the therapy, they go through the treatment. But in the back of their mind is always going to be, will that cancer come back? Even with the most curative intent, right? The thought is always going to be there. So when they got to go back and see their physician every 3 months or every 6 months, the thought of that recurrence is always going to be there. And so what we're identifying is that exercise, particularly when it comes like aerobic or resistance training, is beneficial in preventing the recurrence or preventing the cancer from coming back. What we're doing in my group is really trying to understand the mechanisms behind that, because we really want to have exercise be a part of a normal conversation that a patient has with their provider, right? It shouldn't be one of those 30 seconds, oh, are you exercising? Yes or no?
Right.
You should exercise, right? But it's more of what can we do using an integrative approach that includes exercise physiologists, physical therapists, oncologists, the primary care physician, and bringing all these different specialties together to have a personalized program for each individual right when they get diagnosed. So that way we know exactly how to progress them as they go through the treatment plan and after they go through curative therapy.
You gave us a chart here. I'm going to bring it up
Yeah.
on the screen right now. That I wanted to take a closer look at. It says exercise for cancer prevention and treatment here. And if you can kind of explain this, we kind of look in this circle that's created here on this. What is it? This is trying to kind of show the examples.
Yeah, so that's a infographic from the American College of Sports Medicine's Cancer Special Interest Group. And so they are really the driving body for integrating exercise into oncology care using an integrative approach. And what this group did was they went through the literature and they systematically identified studies that looked at the effects of exercise or healthy living and active lifestyles with respect to prevention of cancer. And what they found was that exercise was highly associated with a reduction in risk for breast cancer, right? Cervical cancers. So a lot of the cancers that are associated with female hormones, renal cancers, as well as bladder, head and neck cancers, stomach cancers, as well as colon cancers as well. Right? And so that's what that infographic is really pointing to. And these are some of these cancers are really aggressive cancers. Right? When you think about an individual with head and neck cancer, oftentimes we identify that individual too late, and they're right. Head and neck cancers usually get identified too late, and the tumors metastasize. But what we're seeing here is that not only in combination with nutrition and healthy living, but physical activity has a potential for reducing the risk for head and neck cancers, as well as these other cancers that are listed on the screen.
And when we, again, it gets back to what we kind of started here is you got to start with your physician and go from that point on. But when we are talking about, these type of things, the common refrain is, yeah, just stay healthy and you prevent cancer. And I think you said great stuff. When you first hear cancer, it is like, all right, I know I'm gonna have to go through the treatment, everything else, but it's what happens after I've done that and it comes back. Because there's so many times we hear the cancer came back and the like on that. What is your research shown that what percentage don't have a reoccurrence or prevent on a regenerative cancer coming?
So let's talk about prostate cancer specifically, right? It's Men's Health Month, and so we'll focus on the greatest number of men with cancer, that's prostate cancer. And so what we're seeing is that prostate cancer, we know 1 in 4 men are likely to get prostate cancer, and if you have a genetic history, meaning that your father or grandfather had it, your risk might go up slightly as well, right? And so with the curative intent for prostate cancer, the nice thing about prostate cancer, let me just tell you this first and foremost, is that it's a slow growing cancer. So if it gets caught early enough, curative intent is there. Treatment modalities are there to ensure that this individual lives a long, healthy lifestyle. So even with curative intent, there could be the potential for recurrence, right? But the therapies that are out there right now are really reducing the risk for recurrence because they're systemic interventions, but you never know what's going to happen. What we're identifying is that by having a physically active lifestyle, you're able to reduce your body fat percentage, and the body fat percentage is what likely is going to drive the recurrence of prostate cancer. There's a lot of research out there that shows that if you're able to reduce your BMI after a curative therapy for prostate cancer, for example, or let's just say colorectal cancer, or even breast cancer for that matter, because men also get breast cancer, so let's not discount that fact. If you reduce your body mass index by changing your lifestyle with exercise and nutrition, you're going to potentially reduce the risk of recurrence by 50%. Right. So,
I mean, that's huge.
That's big, right?
That is massive.
Right. And so just by integrating exercise, walking, right, we've found in my group that if you walk 30 minutes a day, 5 days a week, which is a normal, what we would consider the physical activity guidelines of a normal individual. And we're not talking about running. We're talking about just going out for a stroll where your heart rate's a little bit above resting, that we're able to reduce biomarkers that are associated with recurrence. So a lot of the inflammatory biomarkers that we consider to be significant for recurrence, as well as a lot of prostate specific biomarkers that are associated with recurrence as well. We're significantly reducing the concentration of these biomarkers in these patients, thereby reducing their risk for recurrence. So just go out for a walk.
Yeah. And again, too, those exercise snacks, as you call them.
Yeah, exactly.
I love that.
Yeah.
I just love that. Of course, those snacks may be the only way you can walk with the mosquitoes the way they are after the storm here. That's a motivating factor to get home right away.
Walk faster.
Now, you kind of glossed over when you said, well, what we have found on my team. I think it's important. What we are talking about here, what's been discovered, isn't some far away discovery at all. Your team really found what we call the transcription factors of exercise and reducing prostate cancer and the aggressiveness of tumors. When I read that in your bio the other day, I went, wait a second, this is not just somebody who's an expert coming in on this and stuff. You actually kind of, I don't want to call it the secret formula because it's there. But talk about that process. I'm talking about walking. Let's give you a little bit of a victory lap on your team finding that, because that's one of those keys. It sounds like from what I've read up on this is that that's one of those keys of changing the course in some areas of treatment, of saying, all right, we're not just going to do meds here.
Right.
This is the other thing. We'll put exercise in here as part of it.
Yeah, absolutely. Right. And so again, my lifelong ambition is really to integrate exercise as part of the normal routine conversation that we're having with physicians and their patients, right? But in order to do that, we have to be able to explain what actually is going on within the tumor. So that way we could have an integrative approach and incorporate exercise as part of the normal therapy that every patient is getting. And so what we've done is using the animal model for prostate cancer, we've integrated we introduced these animals to an exercise program. So simple fact was we put a running wheel into the cage of mice that were designed to have prostate cancer. After 12 weeks, we took the tumors out and we did a pathology scan on them, right? And so the pathology came back showing that animals that exercise had significantly lower grade tumors than the animals that did not exercise. So first and foremost, we're showing a benefit there. But next, we're like, okay, what is going on within the tumor that's explaining this pathological manifestation? And so we did transcriptomics. So we took an omics-based approach, right? Everyone's talked about omics. Everyone has heard the word omics, right?
But what does that mean?
What does that mean, right?
Yeah,
So
I hear it all the time.
There's different types of omics research, right?
Okay.
So what we did was transcriptomics. So specifically, we looked at RNA.
Okay.
Right. So RNA, particularly these RNAs are what transcribe the protein, right? So RNA really write the script or write the recipe for proteins to be built, and these proteins go and act and do what they have to do. So if we can make any changes in the pathology of specific tumors, in this case prostate, if we could change the transcription factors that are associated with the development of these proteins that are associated with tumor progression, we could then potentially help explain what's going on in response to exercise, right? So what we found was, I'm going to take a step back. So prostate cancer is a hormone-driven cancer, right? So we know testosterone is a driving factor for prostate cancer. The foundation testosterone is fats, lipids, right? What we found through the transcriptomic evaluation of the prostate tumor was that exercise is actually reducing the transcription factors associated with lipid metabolism. So thereby, we're reducing the potential concentration of testosterone within the tumor. So we're taking away the fuel that the tumor has for it to grow, right? And so that's really exciting for us to be able to help identify now, this is what's going on within the tumor, particularly as it comes to transcription factors go in getting the RNA into protein. And we're slowing down the development of fats within the tumor, which ultimately will then derive testosterone, which is going to fuel the tumor. So we're cutting off the fuel source at the absolute beginning, whereby we're reducing the risk for aggressive tumors.
And when and see if I'm simplifying this the right way.
Yeah.
And so correct me right in the
Yeah.
middle of it, I go the wrong way. Because when you brought up RNA and how essentially, I think some folks have heard about mRNA
Right.
when we're
Yeah.
dealing with COVID with
yeah.
pills and everything else. It's basically finding, the code that exercise, as you were talking about, is creating a code to deal with those proteins, to deal with the cancer.
Well, it's slowing down the development.
Right.
Code,
So it
right?
really is, it's battling it on the most basic
Yeah.
level of your DNA.
Absolutely. Yeah.
right
And that's what we're figuring out, right?
Yeah.
Is that there's genetic changes that are occurring within the tumor in response to exercise, right? So the genes are, the exercise is literally rewriting the genetic code within this tumors that are preventing it from becoming aggressive, right? Just by walking.
Wow. As I said, when I read that yesterday, when your notes came over,
Yeah.
and started realizing what it really meant, because again, I hear the acronyms and everything else,
Yeah.
and I have to go, what's that mean? What's that mean? And it just, and it's happening right here. Again, I folks, I know y'all hear me say this every single show now when I've got someone from the research side coming on with us, but the research that is coming out of this institution, that is, it is game changing, because it's always been known exercise is going to make us better. It's like, it's kind of like up there, don't smoke, we know you're going to be healthier. Eat right, you're going to be healthier.
Right, exactly.
But this is putting real data behind the fact if you do this, your rate of getting cancer drops.
Right.
You do this, the rate of a recurrence of cancer drops, is cut in half.
Absolutely.
And to be able to do that, what's next for your team there? You got the mice running around out there. When do we start having the men running on the treadmills?
Yeah, we're getting there. Yeah, and so some of the things that we have coming up in my group and in my research team is looking at the effects of exercise and physical activity in eliminating some of the side effects that are associated with treatment. Right. So androgen deprivation therapy is a gold standard backbone for the treatment of prostate cancer, because androgen deprivation therapy takes testosterone down to castrate levels. Right. So it takes that fuel away from the tumor from growing. But when you take away testosterone systemically from the whole body, there's going to be secondary effects. And what we found is that by administering ADT, or androgen deprivation therapy, about a year after the initiation of therapy, we're starting to see some cognitive changes in men that are receiving this therapy. What we found in other studies is that exercise is able to maintain cognitive function. And so what we're trying to do is combine the two together. So in men treated with androgen deprivation therapy, which majority of men will, if that's their modality, if we intervene with exercise, can we reduce their risk for developing cognitive impairment? So that's one project that we have going on right now. We'd love to get individuals recruited into. Another study that we'll probably start over the next year or two is looking at the effects of exercise in combination with chemotherapy. So one interesting aspect of tumors is that tumors like a hypoxic environment, right? So they like an environment that doesn't have any oxygen whatsoever, right? Low levels of oxygen, because that's the environment that the tumors really love to grow in. Exercise has been shown to increase blood flow into the tumors, whereby we're increasing oxygenation, right? So that's another potential mechanism by which exercise can prevent the aggressiveness of a tumor. But others have shown, some of my colleagues up at MD Anderson, as well as Memorial Sloan Kettering, have found that when you combine exercise with chemotherapy, you're actually able to drive more chemotherapy delivery into the tumor itself. Therefore, you're getting a better treatment response of the chemotherapy to the tumor. The tumor shrinks a lot quicker. you get more chemotherapy into the tumor itself. And so what we want to do is translate that into men with prostate cancer. So certain individuals with prostate cancer, they have to have chemotherapy. And so we want to put them through exercise intervention while they're going through their rounds of chemotherapy to see if we're able to improve their outcomes and reduce some of the toxicities that are associated, or the side effects that are associated with the chemotherapy. So there's going to be some cool things that are going to be coming out of our lab over the next few years.
That's really look, and we got to keep doing updates on this
sure.
at all when we get past the mice and getting into the real folks that have coming in. And as this research goes on, Dr. Darpan Patel has been our guest today. He is the Vice Dean of Research and Scholarship and a professor also, and a distinguished chair of nursing arts here at UTMB Health. Fascinating stuff. And congratulations to the team. As I said, I knew you were a big deal when they told me you were coming on, but when I started reading about what your team had been able to uncover, this was more than, that's why I saved this part for last, folks, because what he's been leading up to is this kind of the cherry on the top of this whole, to use the whole dessert at the end thing. But cherry on the top of this thing, this wasn't going to be just a lecture, exercise. Wanted to be able to really tell you what his research has found. And this is pure data-driven stuff that they could really use. And what we're going to be doing is we're going to be linking to more of the info you sent over to some stuff, just showing it on a screen, not going to do you any good, but we're going to make it available to all of our viewers here a little bit later, so you can go online and click onto it and read it on the I-45 Now app and on Pod Now to do that. Dr. Patel, thanks for coming on with us. We do appreciate what a great topic, and we'll have you on again as we go on, and keep us up to date with how you're doing, how you and your team are doing, and getting that on. And then I think it's the 6th week of the season. We'll have a little bet on Florida, Texas. Go ahead on, bro. We'll see what happens. I did tell my wife that she's also a UT grad. I said, well, the good thing about being SEC, we're gonna have a lot of fun tailgating at other places. Too. Oh, yeah. So and going to the swamp is gonna be.
You don't know about football until you've been to the SEC.
Yeah, that's for sure. So, all right, we'll have a football discussion show one there too. So, Dr. Patel, thanks for coming on with us. And as always, our past episodes of Healthcare Unmasked are available at Pod Now. This episode, as soon as we wrap it up here, the live show, within a few minutes, it'll be available for replay as well on I-45 Now and Pod Now. I'm TJ Alts, I-45 Now and Pod.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.